My name is Ashley Wamanga. I'm here to talk to you today about reducing social isolation and loneliness in older adults 55 and older living in community dwellings. Employees at PACE care for patients who qualify to live in nursing care facilities. However, they prefer to live at home and receive care. Prior to watching this webinar, please ensure that you've completed the pre-survey and place it in the provided envelope. The title of my project is Knowledge, Attitudes, and Practices of Healthcare Professionals Related to Reducing Social Isolation and Loneliness in Older Adults. In 2020, there were approximately 727 million older adults. By 2050, this number is expected to increase to 1.5 billion, 16% of the world's population. The effects of social isolation and loneliness have a negative impact on the health and well-being of older adults, making it a public health issue to address those at risk early by placing necessary interventions across all healthcare practices. Humans are social beings, making them psychologically hardwired to stay connected with people. Being elderly and living in community dwellings can lead older adults to social isolation and loneliness. It's important to note that social isolation and loneliness can affect everybody, not just older adults. Social isolation is the objective count of relationships, interactions, and contacts. The quality and quantity of social contacts determines social isolation. The lack of a sense of belonging socially, the engagement with others, and the number of social contacts define the quality and fulfillment of a relationship. It is reported that about 24% of older adults living in community dwellings report being socially isolated. Loneliness is a subjective feeling of being alone. The subjective feeling of loneliness is caused by a disparity between an individual's real and desired degree of social connections. Research has shown that individuals who may have several social connections may still experience loneliness, whereas others who lack social connections may not feel lonely. This is because loneliness is related to the quality of a relationship rather than the number. 43% of adults aged 60 and older report feeling lonely. The overall cost of healthcare in the United States is over $4.2 trillion. The Centers for Disease Control and Prevention notes an additional $6.7 billion a year in Medicare costs is associated to older adults being socially isolated, and $406 billion a year in healthcare costs associated to loneliness. With the rising costs of healthcare, working to mitigate social isolation and loneliness is of utmost importance. Biotechnology information describe the risk factors of social isolation and loneliness as treatable. Elevated rates of social isolation and loneliness can be created by the death of a loved one, worsening health and chronic illness, retirement, and/or changes in financial status. Physical health disabilities can debilitate individuals from leaving the house. However, cognitive factors and psychological factors such as depression, anxiety, and dementia may also keep an individual from leaving the home. The outside environment may also reduce social connectiveness, increasing the risk of social isolation and loneliness. Individuals with a reduced education level, reduced transportation, and/or in a high crime area may not be able to safely navigate outside the home. Overall, elderly adults who have an increased social support system, whether family, in-house healthcare professionals, or friends, mitigate the perceived loneliness. To mitigate social isolation and reduce the risk, it would be necessary for older adults to identify their importance of social contacts and support network. Individuals who have many social contacts may still feel lonely and isolated, and individuals who have few social contacts may not experience loneliness or social isolation. Overall, social isolation and loneliness can have a negative effect on the overall health and well-being of adults 55 and older. Short-term or even persistent social isolation with concurrent loneliness has been shown to accelerate cognitive decline and raise the cognitive impairment risk. In addition to cognitive decline, there is a negative impact on both mental and physical health. Evidence has suggested that social isolation and loneliness is associated with higher risk of health-related outcomes such as cardiovascular disease, dementia, and weakened immune system. Separating social isolation and loneliness, loneliness has been linked to increased associations to depression, poor sleep, and hypertension, and social isolation has been associated to an increased risk of heart disease, disability, and reduced quality of life. Improving social skills, enhancing social support and interactions minimizes the risk for poor health outcomes such as drugs and alcohol, smoking, obesity, and lack of physical activity. With the increased risk of negative healthcare outcomes associated to social isolation and loneliness, there is an increased risk of death. Signs and symptoms of social isolation and loneliness may be difficult to initially recognize. Recognizing patient signs can be done by understanding all the possible symptoms. Talking with patients to identify individual factors such as living alone, reduced family relations or support, limited caregivers, illness and poor health, functional disability, which limits one's ability to socialize, and sensory deprivation can identify older adults suffering from social isolation and loneliness. Recognize patients' sleep schedules, their feelings, and contact with others. The key is to interact in a positive interaction, so those who perceive social interactions negatively will describe their feelings freely. Social isolation and loneliness can be assessed using different types of scales. To calculate loneliness, the UCLA loneliness scale is used. This quick scale consists of 3 questions and is a revised version of the typical 2-question scale. For each item, the possible responses are never or hardly ever for 3 points, some of the time for 2 points, and often for 1 point. When calculating the score, the points are then reversed and summed. A score ranging from 3 to 9 indicates greater loneliness. Social isolation uses 5 questions and is called the Berkman-Sim Social Network Index. The total score of 0 to 13, higher scores indicating greater social diversity, and lower scores indicating greater social isolation. The first question is, in a typical week, how many times do you talk on the telephone with family, friends, or neighbors? The second, in a typical week, how often do you get together with friends or relatives, such as going out together or visiting in each other's homes? And third, how often do you attend church or religious services or activities of religious organizations per month? Fourth, how often do you attend meetings of the clubs or organizations you belong to per month? And finally, are you married or living together with someone in a partnership? Older adults scoring significantly high in both social isolation and loneliness, or even on one or the other, should receive recommendations on reducing or preventing social isolation and loneliness. Social isolation and loneliness are interlinked concepts and overlap in ways they contribute to poor health, which require different prevention and treatment, particularly as a healthcare professional. As a healthcare professional, working with a patient to improve social skills, enhance social support, increase opportunities for social interactions, may improve overall health and well-being of older adults. Evidence indicates that the medical community should regulate social isolation and loneliness as a non-medical issue, as physicians and other healthcare professionals play an important role in identifying, preventing, and mitigating the health effects. As a healthcare professional discussing the adverse health effects associated to social isolation and loneliness, and discussing the importance of healthy lifestyles such as exercise, limiting alcohol consumption, and reducing smoking. Encouraging patients to work out, stay active, eat healthy, and participate in group activities may increase healthy outcomes and reduce social isolation and loneliness. Encouraging patients to reach out to others, participate in religious activities or hobbies, and to make a list will help them stay engaged and active. Volunteers may also be available to assist in reducing social isolation and loneliness. Overall, talking with patients and helping them understand the importance of reaching out to a healthcare professional when feeling socially isolated and lonely may mitigate additional feelings in the future. Healthcare professionals can play an important role in combating social isolation and loneliness in older adults. Aging is natural. However, social isolation and loneliness should not be a natural consequence of aging. Early detection and interventions in place may reduce social isolation. After identifying an adult as socially isolated and lonely, providing already established resources may be beneficial to patients. Using healthcare professionals and social resources can be done via social prescribing. Social prescribing allows healthcare professionals to refer patients to resources to improve the health and well-being of patients. Providing patients with available resources will increase the efforts to reduce social isolation and loneliness by linking patients with the support person, communication and transportation services, and potential group activities. Using already known resources is cost-effective and resourceful. Provided is a limited list and potential resources to help patients. Patients should reach out as soon as they feel alone. They should feel free to reach out to family or friends, healthcare professionals, or neighbors. This can be done in person, on the phone, or FaceTime. Patients and caregivers should never be embarrassed or ashamed for feeling alone and isolated. With action, social isolation and loneliness can be mitigated. Thank you for being part of my journey. Now that you have completed this webinar, please open up the second survey and complete the survey. Once completed, place in the envelope and display them in the designated area. Thank you.